My name is Deb Tsorbaris and I'm the CEO for the Centre for Excellence in Child and Family Welfare. We're the peak body for organisations that work with children, families, carers and young people across Tasmania and Victoria. I'm also the chair of Families Australia, which is the national peak body for services that are delivered to families and children across the country. We say that children in out-of-home care are superheroes, but they do come into care with a range of physical, emotional and traumatic needs. We therefore need our kids that come into out-of-home care to get the services that they need quickly to be able to address some of those things that really are of huge concern in terms of what they've witnessed and what they've experienced in their young lives. Children in out-of-home care really struggle to get access to the trauma-based mental health services that they really need. Many of these children have disabilities and physical needs, dental needs, but also counselling-based needs or therapies that they might need to address some of the trauma that they've experienced in their lives. It's very hard for these kids to get access to these services. Usually there's a long waiting list. And for those that are caring for children in out-of-home care, it's incredibly frustrating because they know that with these sorts of services, children could advance pretty quickly and address some of the things that are really getting in the way of them thriving. In Australia each year there's about 300,000 children that are notified across the child protection systems, and about 45,000 children are in out-of-home care at any given time. That fluctuates up and down. If you're a general practitioner or a health person in Australia, often you wouldn't know that a child has been or is currently in out-of-home care. And often there are no records or no current health assessments. It's actually really hard for children and their carers to get access to really good health assessments in this country that will give you the best roadmap for what that child might need in terms of trauma counselling, educational supports as well as behavioural supports, or just sort of really good physical care. Sometimes children need access to really good medicines and therapies that they've never really had access to. So those assessments are really important, and GPs and allied health professionals are best placed to do those assessments. It's really inconsistent across the country. In some states, kids are getting assessed, but it does take time. And particularly for those specialists that are working in what we would say is those sort of behaviour sort of space where children are displaying behaviours that are really disruptive at school and in community settings. There was some really interesting research that we did in 2022, and I'm just going to read this to you because it's quite startling. 1/3 of children in care have a long-term physical health condition. 48% have a long-term mental health condition. Only 41 of 6,000 children in a study had attended all their recommended health checkups. And 83% of young people with mental health challenges said their condition worsened during the COVID-19 lockdown. I'm sure that for those listening today that will resonate. Many children with disabilities enter care undiagnosed, missing out on critical early intervention. So if you think about those data points and you think about the sorts of treatments that children in out-of-home care might need, it will make good sense to those medical practitioners or health practitioners that are listening to this today. What we are advocating for at the federal government level is to have children in out-of-home care and their carers prioritised. So based on what I've just said, we know that often health professionals don't know that children are in out-of-home care or have an out-of-home care history. So we always encourage our health professionals to ask leading questions like, what's the care arrangement with these children? Often grandparents or kinship carers or foster carers will make it clear during their consults that they have a particular relationship with this child. And if that's the case, then it's really important you have some conversations about what the healthcare gaps might be for that child. But we can tell you that right now, children in out-of-home care and their carers experience a system that doesn't prioritise them. And if you can imagine being a carer for one of these children, it's not easy, rewarding but not easy. So we're saying to the Commonwealth Government that we want a priority access for children in out-of-home care to all of the sorts of treatments and remedies that children in out-of-home care might need. priority access to mental health services, priority access to dental health services, priority access to basic physical and health services in our care system, in our health system. And right now they don't have priority access. So we're really saying to the Commonwealth Government, please see this group of children as an equity group, and that they will always get to the front of the queue when they need any sort of service that will assist them with the trauma that they have faced or the trauma that they are currently facing in their lives. The other things that we're really interested in are based on the fact that we know that in Australia, foster caring is on the decline. People are finding it really difficult to make the call to become a foster carer for all sorts of reasons. Our demographics are changing. The economic circumstances of Australians has been pretty dire in terms of the cost of living crisis. Carers are ageing out, and actually, it does. Let's put it this way: it's not for the faint-hearted. Some of these children have really, really high needs, and we need foster carers to keep wanting to foster care. So on that basis, we are calling on the Commonwealth Government to do a couple of things. One is to ensure that those that become foster carers actually get the leave arrangements that they need. So whether it's paternity or maternity leave like other families, or whether it's additional leave for you to attend medical appointments or attend school when you need to support your child in settling into a school. We really want foster carers, those that care for children in home-like environments, to get those additional benefits. We know they need them, they talk about it all the time, but they don't get access to them. And the last thing is to make sure that the tax arrangements that foster carers benefit from are the right tax arrangements, and they're put in place. At the moment, most foster carers get a small allowance from the state and territories, but they get no other benefits. So how can we make sure that carers, particularly foster carers, get the same sort of family tax benefits and the benefits from the tax arrangements that they currently don't get? So they're the three things that we're looking for. We believe that those three things combined will mean that more people want to become foster carers, but children themselves get the full benefits, and what I would say is the early benefits that could be made available for them in our current health system in Australia. You would be surprised to know that children in out-of-home care wait in the queue like everybody else. And we would say that these children often need urgent care in order to make sure that their placements are stabilised and their carers can care for them adequately. For primary care and allied care professionals, I would say to you, please ask the question. Nobody ever will be upset if one of you in your role were to ask a carer or a child themselves, particularly if they're a younger adult, are you in care or have you been in care? It will then mean that you can seek the right training, but also prioritise those children and young people and carers for a service earlier than you would have anticipated. We know that for some children, the relationship with an allied health worker, a GP or a clinical specialist can make all the difference, because actually some of those needs might outweigh all of their other needs, and they might be something that those children and young people and carers prioritise, and they can't get those needs met. I'd say to you that certainly in Victoria we've got things called Pathways to Good Health, where community health workers are assessing kids in out-of-home care to get their needs met, but we're still struggling to get those children and young people into the specialist services that they need. So when somebody rings up and they say to you, I need a service, ask the question, who are they? What's their background? Is this a carer? Are you a foster carer? Are you a kinship carer? And is there some priority you might need in getting access to those services? And you know, people will open up to you and tell you this, and maybe you can just provide them with a jump start on getting their care in terms of timing. I must say that for all of us, it doesn't need to be a social worker or a teacher, but it can be an allied or health practitioner that can make a difference in these kids and carers' lives. So please ask those questions. It could make a real difference. In terms of training, certainly here at the centre, we're always happy to receive calls from allied health professionals or GPs, anybody who's working with these kids, to answer questions and provide direction or the right training so that you can ask the right questions and provide the sort of service that might need to be provided. But you are the experts, and so often once you assess these children, it will be you who can make sure that they get to the right specialist. It's not something that an organisation like ours has expertise in, but you do.